Over 3,500 years ago, Egyptian surgeons described the human brain before modern medicine even knew what it looked like. In 1862, an American collector named Edwin Smith bought an ancient papyrus in Luxor. What he didn't know was that this scroll, written around 1600 BCE, contained the earliest known surgical treatise in history. Modern scholars later called it the Edwin Smith Surgical Papyrus. Inside were 48 clinical cases, each describing real injuries, diagnoses, and treatments used by ancient Egyptian physicians. One case stunned modern doctors. It detailed a patient with a severe skull fracture exposing the brain. The papyrus called the soft, pulsing material inside the skull the marrow of the head, the earliest written reference to the human brain. The surgeon who wrote it described symptoms we recognize today: loss of speech, paralysis, seizures, and cerebrospinal fluid leakage. Even more shocking was the method. Egyptian physicians cleaned wounds with resin and honey, stitched lacerations with linen thread, and immobilized the skull using stiff bandages. Every step followed a clear protocol: examination, diagnosis, treatment, and prognosis. For the most severe head injuries, the ancient author even used modern triage language, calling them an ailment not to be treated. When the papyrus was fully translated in the 1930s, neurosurgeons were stunned. Techniques they thought were modern, clinical observation, prognosis, even early neurology, were already being practiced in Egypt over 1,000 years before Hippocrates. It's one of history's greatest ironies. The oldest surviving surgical text is also one of the most scientifically advanced.